We're News Talk 98.9 FM and 1400 AM KFRU. And it's good to be able to welcome the CEO of the MU Healthcare, and that is Jonathan Curtright, someone who I've been able to talk to at different events over the years, and welcome him to the program for a visit this morning. Good morning. How are you?
I'm doing well. Thank you so much for having me, David.
Let's talk about something that came out last week, and it was from the University of Missouri, and they were talking about their statewide impact, economic impact. And I think an important part of that is also what MU Healthcare brings to that. Can you put into perspective and the context how MU Healthcare fits into what the University of Missouri system brings to this state?
Sure, happy to do that. But before I make some comments, I just really want to congratulate you on an incredible career and welcome you to the next phase of your journey. If Mike Kelly is the voice of the Tigers, I think David Lile is the voice of Columbia. And over the years, as we've traveled back and forth to Columbia throughout all of our different journeys, I've always so enjoyed listening to KFRU and hearing your voice. It was like this beacon of stability in my adopted hometown. So congratulations, David. You've had an incredible career.
Well, I appreciate that very much. Those words are very kind and very meaningful to me. So I thank you for that. And it's more important, though, to talk, I think, about the University of Missouri healthcare and the impact it makes on the state.
Yeah. Well, I do think that MU Healthcare is a critical part of the overall University of Missouri. We represent ballpark 40 to 45% of the total revenues of the entire University of Missouri system, and a very significant portion of the total profitability of the University of Missouri, and of whom much is given, much is expected. And it is true, we are a critical part of the economic engine that is Columbia, Missouri, and we take that very seriously. And we hope that people are able to get great health care and do it in a very cost-effective way, and do it in a way that is very patient-centered. But yes, it is true that we are a key part of the economic engine of the overall University of Missouri. So thanks for asking.
Help me understand this. How long have you been with the University of Missouri in your current role?
Yeah. So I just had my 6th anniversary, 5 of which has been serving as the CEO of MU Healthcare, and then my first year I was the Chief Operating Officer for MU Healthcare. My wife, Lori, and I are both proud Mizzou alums, and we graduated, I graduated undergrad in 91, and she graduated in 93. So this has always been home and always will be home. So we love it here.
This is the reason that I asked that question. So let's go back 5 or 6 years, 2015 or 2016, and then what you have been through over the last couple of years. You couldn't have anticipated what that is, but what has been the biggest challenges that you have faced through the COVID pandemic time as CEO of MU Health?
Yeah. I think the biggest thing is if you were to graph, I don't know if you've ever seen a graph that describes the inspiration of a country or a society at the beginning of a war. But there's this great amount of incredible optimism, and we're all in this together. And then over time, it starts to wane because people get tired in the midst of this very challenging war that they're facing. And I don't want to over-dramatize this, but symbolically, I do think that there's some similarities here. At the very beginning of this, there were the healthcare heroes. There were people buying Shakespeare's pizzas and crumble cookies for all of our staff. And then over time, we had the incredible joys of having a vaccine that would come out that would effectively battle this, and then we had the vaccinator clinic, and the highs have been incredibly high, but now it is just this day-to-day challenge that we're facing to take care of our community in Central Missouri and our greater state, at the same time that people are also having other healthcare needs that are out there. So I would say the biggest challenge we're facing is just inspiration, motivation, and keeping everybody moving forward and motivated to continue this incredibly powerful fight that we're facing every single day.
I think you've described that well. I want to put a different image in it because I just look from the outside, the waves that you have to ride, because we think of the Delta variant and then kind of a drop off of that. Then Omicron comes along, and now we're in I look at the numbers every day that are posted very early by MU Healthcare, and the hospitalization number this morning, I think in the 3 o'clock hour, was 82, but just a week or so ago was 130 plus, and the waves that you go up and down. To keep the morale and the forward progress that you talk about of staff and of those who are dealing day to day with these kinds of issues, that's quite a challenge.
It really is. I mean, just think about 6 months ago. In Boone County ballpark, we had about, say, less than 5 active COVID patients per 1,000 population. It spiked all the way up to nearly 40 in this last month, and now it is down significantly. I'm looking up the data right now, but and our total inpatients that have active COVID or COVID past COVID has gone from 21 6 months ago to 133, and you're exactly right. It is waves and waves and sets of waves. I'm a surfer, and so I appreciate that that analogy and metaphor that you've described.
So, what is it going to take in the future? What have hospital executives and administrators learned that now, because many of the experts say this isn't the last, maybe not the last of COVID, and if it's not COVID, it'll be something else. So, what do you learn and take forward from this?
Well, I would say a couple of things. How about just having some resolve that this probably won't go away, and learning to live with this in the same way that we've had to learn to live with influenza and an influenza vaccine, that is more the norm now, and that we're constantly fighting influenza. I think that COVID is going to be like that. And we're going to have to continually we're going to have to continually be resolute that we are going to fight the good fight on this and always keep the health of our community moving forward. But I would also say that, David, that not everything has been bad about COVID. There have been some things that have come out of COVID that are I think are actually helpful in a sense. Like, for example, I had to wear a tie every day to work for the first 25 years of my career. Now, hardly anybody wears a tie, and that's not necessarily a bad thing. But at the same time, another example of this is that we've been able to make some incredibly challenging but important decisions at MU Healthcare, and not the least of which has been that we now are going to have one unified inpatient hospital campus at the University Hospital campus. We're going to be moving our new children's hospital from the Women's and Children's Hospital campus on Keene Street and opening that a brand new, incredible facility in the summer of 2024. And I do think that COVID allowed us the resolve that we knew we had to make some incredibly hard decisions to ensure that we had an outstanding and sustainable practice. And I do think, and I've said this to many people, I think that COVID was the catalyst that made it so we were allowed to make some of those hard decisions.
A couple of minutes left with Jonathan Curtright. He is the Chief Executive Officer of MU Healthcare. So in order to continue to be such an important contributor to the success of the University of Missouri system and for healthcare to this area, what is in the future as far as acquisitions or expansion with MU Healthcare? You talk about unifying the services, bringing the Women's and Children's Hospital onto the campus there, and that is something that is taking shape and has already had several moves to it. But what else needs to happen to continue to look and be forward-thinking?
Yeah. Well, one of the things that we do, and I think we take great pride in this, is that we are the provider of healthcare services, predominant provider of inpatient and subspecialty services in central Missouri. And rural healthcare is a critical part of what we do. And so if you were to go to Boonville right now and drive past that closed hospital in Boonville for Pinnacle, it's kind of sad in many regards. But one of the things that we've decided to do is that we are going to be providing and growing these ambulatory or outpatient facilities in many rural communities surrounding surrounding Columbia. And it could be for things like imaging, or an urgent care center, or family medicine, or child health. And it's going to make it so that it's a different model, but we are absolutely committed to ensure that we have good, solid access into MU healthcare, close and local at home, surrounding Columbia. And a good example of this is Boonville, but we also have examples of this in Fulton. There's going to be some new opportunities we just opened up a practice like this in Ashland. And then also, we also just have a very outstanding, and frankly, I'm calling from there right now, an outstanding relationship with Capital Region Medical Center, a 25-year-long relationship, ensuring that we have good, solid access into the Jefferson City and Cole County as well. So growth but appropriate growth is going to be a critical part of what we do moving forward.
Let me just throw this out because I'm curious. I'm from Macon. I know they have the Samaritan Memorial Hospital in Macon. Is there any connection? Growing up, I knew of people that came down to MU Healthcare, University of Missouri Hospital, regularly. I guess that's where they went to get their care oftentimes. So a couple of counties away. Plans for like those kinds of connections?
Yeah, well, and thanks so much for saying that in Macon. I think my parents are listening right now, and they're in Monroe County in Paris, Missouri. I agree with you. We need to always be open to, once again, we are very, very open to the idea of rural health care, pushing as much of primary care, urgent care, limited imaging, that sort of thing, to make it so people can have immediate access in their communities. We have an example of this, as you probably know, in Fayette. So we are open to multiple opportunities, and I think you're going to find over the next decade that there will be many examples of this sort of model throughout Central Missouri.
Let me ask you this before I let you go. What's on the platter of the CEO of MU Healthcare today? What kind of reports or what kind of meetings? What will be the important objectives for your to-do list today?
Well, I'm in the next 10 minutes, I'm going to go into the Capital Region Medical Center Executive Board meeting and ensure that we're continuing to have an outstanding relationship with Capital Region. We are always looking for ways that we can improve our operations in Columbia. So if you think about it, our South Providence Clinic across from Rockbridge is an incredible piece of property with a wonderful primary care, and I think that there's options for that for the future. And then if you were to look at my afternoon, like all things, we run. This is a business, and we run this is important business, So this afternoon we'll be talking about how we can make massive investments in our School of Medicine and grow cardiovascular and oncology care and neurosciences with our partners in the School of Medicine. So those are examples of work that I'll be doing today. Hopefully we are doing it in a way that is beneficial to our community and to our university.
Well, I appreciate the time that you've given us this morning, and we'll let you go and get to those meetings and get to that work ahead. Thank you so much for the contact and for the opportunity to talk about MU Healthcare today.
My pleasure, David, and congratulations once again.
Thank you. Jonathan Curtright, who is Chief Executive Officer of MU Healthcare, has been our guest at 98.9 FM and 1400 AM KFRU.
Titus and Tate, a podcast from two obsessed basketball lovers.
John Calipari had sent an autographed basketball to the Pope, and I was like, I'm just trying to figure out how it's fake. Like, did they Photoshop the? Like, I'm like, I don't get it. Like, am I too old to get what the joke is?
It's not a joke at all, and it's also like in my mind now, the Pope is a Kentucky basketball fan.
The Pope is a Kentucky fan, but God is a Memphis fan.
More than just analysts and stats. Titus and Tate. Listen wherever you get your podcasts.